everyone, my name is Jodie Balvin and I am your host today. My topic is on health improvement practitioners and how they can help you in your medical centre. They can help improve productivity and better outcomes for your patients. Let me start by telling you about Emma. Emma is a 14-year-old girl suffering from anxiety and depression. She has been exposed to bullying and pornography and is self-harming. Her mother, desperate, took her to a doctor for help. The medical centre was short of doctors, and on this particular day, she was seen by a new doctor, unaware of her family's values or culture. This took time in the consultation to get a history and then understand the major concerns and connect with the patient. Once an assessment was made, a short-term plan was created with apps and websites for Emma, and a little bit about exercise and healthy diet prescribed. There was no time left for further investigation or treatment, so Emma was asked if she would like to talk to a health improvement practitioner, HIPS for short. Her name was Jenny, and she spent 30 minutes with Emma getting to know her and building a rapport. This was the beginning of talk therapy for Emma. Jenny introduced her to positive strategies and techniques. She encouraged reflection and dialogue, which took a few more sessions. In this short story, we see that the doctor did all that she could in this short consultation, but this highlights that mental health needs time and effort. Let me tell you about another patient. It happened today, an incident with a mature woman who came into the surgery. We will call her Joan. She was caring for her aged husband and having a hard time of it. There were no appointments available and she was upset. The receptionist was able to connect her to Jenny, and even though she did not get what she came for, she got a listening ear. She got some good practical tips and reminders for her to move forward. In a 15-minute consultation with a doctor or nurse, obviously there's not enough time to adequately address topics such as well-being, self-perception, autonomy, hope and hopelessness, relationships and belonging, lifestyle choices or ruminating. My call to all clinicians now is to utilize your HIPS. They are qualified providers, ready to support in all mental health challenges your patients are facing. Thanks for listening to this short segment. This is supported by the Balvin Foundation. And if you have time, feel free to check out my website. It's called hipsandyou.com. Bye for now.